All right, everybody. So now we're going to have a conversation once more with Apostolos regarding our health. Excuse me, everybody. I don't want to be rude. Lexi, you need to help me. All right. Welcome, everybody, to those of you who are tuning in here to Davos Lodge 2025. I think today's July 22nd. I haven't slept, or January. Haven't slept in a few days. Apostolos, welcome back on stage.
Thank you, Dustin.
You and I have had this time to really have an engaging conversation about the world and technology and innovation and healthcare. And some of it that is accessible and others that are going to be in the future, and wearables that some of us have on our fingers or on our wrists and others that aren't doing it. Your health matters. You and I had this conversation yesterday, and you were so passionate about it. And to anybody that knows passion, it is quite contagious. And you told me your health matters. Talk about this.
Actually, Dustin, it's the only thing that matters. It's exactly what we said before in the panel. If we have a strong health, strong mentality, then we can really do everything and enjoy our lives. It's clear for everyone. But most of the times we don't follow it due to our everyday schedule. Everybody's pretty busy, making money, running businesses, and in the end we forgot about the most essential thing, which is our health. And in this direction, what I want to say is that the wearables themselves are not the solution. The diagnostic devices are not the solution. Of course, you should have the measurements and to have the indication and to know early enough in order to be able to prevent things from going wrong. But the point is how you handle the situation after you will learn that you are suffering from something or you are in risk from a chronic disease or whatever. Because most of our health issues are able to be controlled as long as we will perform scientific protocols in a way that they will allow us to change our lifestyle and lead ourselves to adherence and to a better way of living.
So anybody in the room, hopefully everybody says yes here, they should. Anybody here been sick before? Like had a boo-boo, a sore throat, COVID. I had it a couple times. I know COVID had my name. And it's this contrast in life, isn't it? That we seem to take for granted when we're well, when things are good. And as Mark Kohler would tell you, that it's to, in essence, live like nobody else. So one day you can live like nobody else. Prepare for the day that things might change around you. It's this preparation. But why don't we prepare our health? Why aren't we doing more to prevent?
As I said before, I think there is lack of information, lack of official information, of information that we could trust. So in this direction, HD Corner that I mentioned to you, and as you said, I was extensively passionate about it. These health services regarding the CVD, and we focus in CVD due to our experience in the diagnostic devices in this category, blood pressure monitors, glucose meters, etc. So we decided to create these health services that have as a base the scientific protocols and are empowering the adherence under an official way, systematic way. So the clinical coaches that we have deployed around the country in the pilot project in Greece that we're running right now, having, of course, the tendency and the willingness to expand it all over the world, and United States is maybe the country to have such an adaptation due to the huge fiscal burden that they have. And of course, the lives that are being lost from the CVD. It's #1 cause of death.
Why?
Because it's everything is involved. We are referring to obesity. When we say cardiovascular disease factors, we're referring to obesity, hypertension.
My country, by the way, the United States, someone will probably, I know, Patty, you might have the stats on this, that obesity in the U.S. is out of control.
And it's actually the basis to acquire hypertension, diabetes, and dyslipidemia. So these 4 risk factors,
and
plus,
depression.
excuse me, of course, there are also parallel effects, bad effects in your lifestyle, in your health. But except that, if you will add on smoking as well, which is the 5th risk factor, then you are ending up with heart attack, strokes, blindness, and actually you have no life quality at all. So our health services is doing exactly that, but as I said before, under a systematic way through the clinical coaches, pharmacists, that are closely collaborating with the physicians. So in the role of a clinical coach, the pharmacist is training the individuals to empower their adherence, know about the lifestyle adjustment they should do, such as nutrition, exercise, how to store their data, how to store the medical examinations, in order for the doctor, the physician, to have a trained individual and all the data he needs in order to prescribe properly and lead them to control. And this is essential. So it's not about the diagnostic devices and about the wearables, Dustin. The point is what you do after, as I pre-mentioned, and how to handle it. So if people have information that they can trust, approved from WHO or national healthcare systems, then they will follow it as long as they are enjoyable as well.
I like this, but you said something, and I know, Patty, you have coached me personally on this, is that we have these self-sabotaging behaviors about ourselves. We sabotage. How do we get away from that? I mean, you are in the world of changing outcomes.
Yes.
How can we prevent sabotaging ourselves once you've deployed the technology that could improve the outcome?
Our research and development department, which has the honor to host many key opinion leaders around the globe, hypertension experts, diabetologists, etc., plus psychologists, clinical psychologists, that are an essential part of our success in these health services, they focus in enjoyability as well. People need to enjoy. When you will recommend them to change their lifestyle, they need to understand that this will be fun as well. Because it's more fun today to eat whatever you like, drink whatever you like, and do whatever you like. Point is to show them that there is another world, to show to the people that there is another world that they can live in, and they can be active, enjoy their time with their grandchildren, with their children, with their friends, run in the mountains. You said before, no, Tim said it, I'm sorry, Dustin, that all the Swiss people around here are bicycling, moving all day, hiking. So that's the way to do it. We need to show another side of enjoyability to the people, that they need to make this transformation, individual transformation, to a better life. I think that's the key.
It's this better life mindset. So partnerships, it's incredibly important for organizations like yours.
Yes.
Because without partners, well, we don't have distribution. And some of the best technology, some of the best ideas or best companies, they collect dust and they ultimately close and die. And what could have made a difference, which could have changed the world.
You are so right on that. And that's why I said it needs to be systematic and to be organized properly from, even I would dare to say, all countries in the world. And that's why I referred myself to WHO before. It needs to be adapted. All these health services, it's not only our effort. I'm sure there are more. I heard about Livongo in the United States, that they did a great job with diabetes, and they succeeded greatly with very good outcome. I read the studies. Or Kaiser Permanente, a health plan that has delivered excellent results in controlling hypertension. So all these excellent solutions that are going to be somehow approved, maybe from FDA, under a certain protocol, needs to be adopted from the health plans, insurance companies. They need to be reimbursed, for sure, at least in a percentage, because the people need to feel that someone, his own government, is supporting the improvement of life quality, of his life quality, and it's an obligation of the countries to do that in order for the citizens to have a better life, especially when we know that this is a major problem. Pandemia. CVD is a pandemia. This is the real pandemia, Dustin. I mean, don't fool yourself. COVID is nothing comparing to CVD. First of all, it needs to be adopted from the governments, public insurance companies and health insurance companies, as well as from the large corporations. There are several corporate wellness programs that need to adopt such services, and they will also earn out of it due to not loss of productivity of the greater investment they make, which are their executives, their partners, their employees that are there to support their daily profitability. So the corporate wellness programs also needs to be very sensitive and to offer free of charge health services to the people that are working for the corporations.
Thank you so much for this fireside chat, Apostolos Karabinis Medical.
Thank you.
Thank you to my life coach,
Thank you so much,
Patty
Dustin.
Campbell, for teaching me a new mindset, to always be ready to hear when I'm wrong. And there were many things in this world, I think, and I'm always open to learning. Thank you so much for your time.
Fantastic. Thank you so much, Dustin. Lovely meeting you.